For nearly 30 years, CASA has been providing a solution for homelessness by offering access to affordable rental apartments across the Triangle. We know that homelessness is complex, but so often the answer is simple. It's housing.
On any given night in Raleigh, there are about 1,000 homeless people out in the cold, sleeping on the concrete and in the woods.
I was out there missing friendship, wanting people in my life. And I wasn't even focusing on housing. I'm thinking I'm gonna be there forever. I literally got a trash can and put myself in it because it was just that cold. I'm like, I can't do this. This is not me. It's not me.
After walking alongside many homeless women, I've come to learn that they really aren't that different from me. They just want to be seen and known and loved. And even in the midst of the most difficult circumstances, they remain hopeful and resilient.
We have a motto in healthcare that housing is healthcare, and that a lot of times it is an absolute exercise in futility to try to treat underlying medical issues or even behavioral health issues if patients don't have stable housing. It's not hard to imagine why, and it's very multifactorial and complex, but it's not hard to imagine why that mortality in chronically homeless is still in its 40s. And a lot of those reasons have to do with the stress and the issues that come with being homeless, not being able to get good sleep, always being stressed, having to sleep outside, being exposed to the elements. It is not conducive to good health.
Being able to meet the needs for affordable, safe, and sustainable housing is a challenge for us globally, it's a challenge for us as a nation, and it is especially challenging for us here in Wake County, especially now as we see the demand for housing increase as our supply continues to tighten. And when you add on top of that the effects of the pandemic, especially for those most vulnerable, whether that be families or whether that be individuals, it's obvious that we have a crisis on our hand. And it's a crisis that we together need to find a solution for.
When COVID hit, a lot of things shut down in our society, including a lot of homeless shelters and social service nets. And a lot of patients were literally left outside. And we were immediately concerned around the homeless because we know historically with respiratory diseases like the flu, it hits homeless patients much, much harder. And that is the case. That's what we've seen with COVID, that the mortality related to COVID is about 1.8 times that of the normal population. But we've also seen, predictably, the social consequences of COVID and the mental health consequences of COVID. And we're seeing suicide rates go up. We're seeing overdoses go up significantly. Record year in 2020 in terms of overdoses and hospitalizations related to overdoses. And so I think COVID has shined a bright light on a lot of things, from a societal perspective, how vulnerable they are to these things, not being housed and having to be outside in the elements, and maybe some solutions of how we can do this better.
Since 1992, CASA has grown and expanded our properties, staff, and tenants to encompass a broader population of individuals in need of affordable housing. Currently, we own and manage nearly 500 apartment homes, serving more than 650 people every year. We're about giving people access to a safe place that they can afford, where they can live as long as they want to, and where they have the support that they need. We know we can be successful because we see it every day. We know people can overcome incredible obstacles when they have the foundation that home provides.
I've been able to work with a lot of homeless patients who did move into housing, and I can't begin to explain how meaningful that is for a lot of these patients who have suffered from chronic homelessness, and what that means in their life in terms of what they're able to do to improve their health.
When I first moved in my CASA apartment, I was thrilled about the idea of just having a place. I sat in there and started putting things together, putting pictures on my wall. I have a place I can call my own, which is CASA. It just brought so much life back into me.
So I started small. I got a job at a local dry cleaner, and I just gave it everything I had. And I've been promoted several times. And without that stable place to live, that never would have happened. It's amazing being able to provide for him in the way that he needs and to have a safe, secure place where he can, grow up, and I can be there for him as a father.
When I moved in, I was happy. God, I was happy. Because I didn't have my own place, and I'm 52 years old, so it's like all my life I've been on my own since I was a teenager. So this was the first time I didn't have my own place. And so the year that I was without my own was challenging. So this is my house.
CASA has far more applicants for housing than housing for applicants. We know that the need continues to grow, and we have a plan. Kings Ridge will reduce homelessness in Wake County by 10%.
In the fall of 2019, CASA purchased 6 acres of land in Raleigh, near Wake Medical Center. And finding and purchasing this land was a huge win, but it was only the first step in a bold vision to end homelessness for more men, women, and children.
Kings Ridge will be 100 apartments for men, women, and families with children who are currently experiencing homelessness. There will also be supportive services, medical services, mental and behavioral health services, case management, and community space, all to ensure that they have a safe and stable environment in which to live and in which to heal.
Kings Ridge is a great project, and it's a great opportunity. And this isn't just about housing. This project is also about a community coming together. And the residents here will be part of that community. They now have a place when they go to register to vote that they can put their home address. So many people, that is so important. You now have a place for your kids to say, hey, I live here. This is my base school. This is the next school I'm going to. Kids growing up next to each other, playing in the open space area. Those are memories that you only have when you know you had a place where you were able to lay your head and felt safe.
You step back and you say, yeah, it can be really hard to solve these complex problems that lead to a lot of suffering, that to lead to a lot of cost. And yes, we're not going to be able to solve this if we stay within our own individual silos, either from a social service perspective or from a healthcare perspective. That it's going to take a level of collaboration maybe we're not used to. But that level of collaboration is possible. If we're able to do that, then maybe we can really reduce the suffering of our most vulnerable residents in our community. I'm extremely excited about Kings Ridge. I think that it can really provide an opportunity for us to demonstrate what is possible through community collaboration for our highest risk and most vulnerable homeless residents.
So often we talk about Raleigh and we're a place for all. Well, being a place for all is making sure all have housing. Being a place for all is making sure that everyone has an opportunity to grow and nourish. That's why Kings Ridge is a part of that growth, a part of Raleigh truly being a place for all, so that we can truly be one Raleigh.
By launching this campaign as a public-private partnership, we can make a bigger impact than government or the community could do alone. Kings Ridge is named in memory of Deborah King, CASA's longtime CEO. Her heart for people who are left out and on the outside looking in never shied away from a challenge. We are so excited to bring Kings Ridge to Raleigh.
Kings Ridge is a collaborative effort, supported by a variety of businesses, healthcare providers, local government, faith communities, and people just like you. Join us and learn more about Kings Ridge at casanc.org.